and it remains still darker inside, and then we call it corpus luteum. As soon as the egg is out, we call it corpus luteum. So this is now corpus luteum, and this corpus luteum, you will say, is that big. Okay, so you will see the wall is thicker, and inside there it will be anechoic, or there will be internal echo, that is the blood clot, that is Graafian follicle. Please make sure when you see it, that is corpus luteum. When you see it, please record it and measure it and click the color. Okay, so you got the idea about the follicular cyst and the corpus luteal cyst. Follicular cyst, when you need to measure, so you need to measure from here to there, here to there, and also in transverse. In transverse, you will measure the width. The Graafian corpus luteum, yes, measure here to there, here to there, both in SAS and in transverse. Okay, sometimes you will see this is ovary. So this is the Graafian follicle or corpus luteum. You will see inside the ovary. So this is ovary. Ovarian cortex is very thin. Why thin? Because it is now under compression of the cyst inside. So this is cyst. Sometimes it could be very enlarged Graafian follicle, or it could be big corpus luteum, or some pathological cyst. So now, if I want to measure the, if I want to measure the ovary, I have to measure like that. But if I want to measure the follicle, I have to, from here I have to measure the follicle Okay, so that's the way we need to measure. Okay, so sometimes even though we don't see the cortex, it's so big cystic. So what I do, if we, so this is ovary with cyst. Sometimes this is ovary and this is cyst. And if I want to measure the ovary and I don't see the ovary, ovarian cortex. I see all through it is cyst. So what I do, I measure the cyst. Say I'm measuring the cyst here to there. But if I want to measure the ovary, I figure it out that ovary is this. I figure it out that ovary is like this. I just put the caliper a little outside from here to there and from here to there. Okay, so that's the way I measure the ovary and the big cyst. And also I click the color, I see the blood flow around it. Okay, so this is the follicular cyst and the corpus luteum cyst inside the ovary. So you need to remember that. Now, para-ovarian cyst, let me show you. Para-ovarian cyst. As I said, para means by the side. Okay, so this is ovary. And by the side of the ovary, you see like that. So this is ovary and these are cysts outside of the ovary. So these are para-ovarian cyst. This para-ovarian cyst is growing bigger, and it could be very big, and it is a simple cyst. Okay, so we need to measure the biggest one. If there is a more multiple para-ovarian cyst, you may measure the size of all of them, but mention that there are multiple around the ovary. The biggest one is this. Okay, you have to mention. But don't forget to evaluate the ovary. Ovary may have a cyst inside, the follicular cyst, corpus luteal cyst inside. Make sure you evaluated the ovary and get confirmation that these are the cysts by the side of the ovary, not inside the ovary. So this is para-ovarian cyst. Now, serous cyst adenoma. Serous cyst adenoma, as I said before, that it is considered as a simple benign cyst. It is a cystic version of the adenoma of the ovary, and it arises from the epithelial cells origin, and it is a simple cyst. It could be bigger, uniloculated, and the wall is less than 2 millimeter, and there is no septation, no debris inside. Okay, so now you are scanning. Okay, and you don't get the ovary separated. You see that is a big cystic, and if you are lucky, you might get some ovarian tissue over here. And this is a cyst, and this cyst is filled with serous fluid, lighter fluid, not lubricating fluid, simple saliva fluid. Okay, so this is serous cyst. What is the criteria? So uniloculated, usually unilateral, so 90% unilateral, 10% bilateral, thin wall, less than 2 millimeter, no septation, debris, no septation, no debris inside, just as simple, and it may go 10 centimeter, 15 centimeter, like that. Okay, so this is serous cyst adenoma. But question, how can I measure it? You have to measure the ovary first. Then you need to measure both sag and transverse, sagittal and transverse. In sagittal you are measuring the length and height, and in transverse you are measuring the width. Okay, and also you are measuring here you are measuring the cyst. When you measure the cyst, usually we measure only the anechoic area, inner to inner. Okay, so that is serous cyst adenoma. Good. So now we covered this benign simple. Now I will go over the benign complex. Benign complex Number one, this is benign, not harmful, not malignant. Complex means not simple. Then what is the difference from the simple to complex? Complex is The wall will be thicker, irregular, non-smooth. There will be internal septation. It could be multiloculated, multiple septation, lot of cellular debris and sedimentations. And there will be enhancement, posterior enhancement, and there will be edge refracting shadow. Okay, only 2 points, 2 items are different than the simple. So complex will be complex looking, not simple. Okay, so benign complex cyst or benign complex, so it's better to write down masses, because these are the cystic version of the masses. So now mucinous cyst adenoma. Mucinous cyst adenoma so it is in the ovary. It could be such a big one that it will not actually be captured in one image. So okay, within the ovary you will see a big, actually you're not going to see the ovary. It is a big mass, okay? Big cystic mass. Then you will see irregular, thicker wall. Internal septation. Multilocular. What does multilocular means? Multilocular means multiple chambers. Okay, multiple chambers, multiloculated, and you will see sedimentation, due to debris. Okay, and the wall will be, oh, I mentioned thicker. Thicker means is greater than 2 millimeter or equal to 2 millimeter. Usually in the cancer version, mucinous cyst adenocarcinoma, that thickness of the wall will be really greater than 2 millimeter. So it is better not to point out this here, that we will discuss in malignancies. Okay, so now can I see the ovary here? No, it's such a big one, and you need to measure the ovary if it is a complete. Okay, and you measure inner to inner. Okay, so that is mucinous cyst adenoma. So now let me read it from here. Okay, these are common epithelial tumor filled with thick mucoid fluid. They comprise about 12% of all ovarian tumor. 10% of the time they are usually bilateral. That means 90% they are unilateral. And the sign, the patient will have a palpable mass and the pelvic pain due to the pressure. The sonographic appearance, large complex cyst with good posterior enhancement, usually 15 to 20 centimeter, but they may reach greater than 25 centimeter. Usually multilocular, must demonstrate some criteria of serous cyst adenoma to be considered sonographically benign. Must demonstrate some criteria as serous cyst adenoma to be considered sonographically as a benign. That means wall thickness cannot be greater than 2 millimeter, and internal septation and hypervascularity. Hypervascularity can be a malignancy, but you have to click the color. If you see, it goes mostly with the serous type, so it is benign. As noted previously, it is usually unilateral. So this is the mucinous cyst adenoma. But the one thing is that sonographically you are not going to diagnose the case right away. The final diagnosis is coming by the biopsy. That's why you have to wait until the biopsy report comes. Okay, so this is a very important. And now let me go over the cystic teratoma. Cystic teratoma is the most common benign tumor in the young age ovaries. That means if a teenager girl comes, or in the 20 or 25 years old girls comes with the tumor in the ovary, so mostly it is cystic teratoma. Mostly it is cystic teratoma. So it is a germ cells tumor. It is most common. Okay, so benign tumor in the ovary in the young age. So cystic teratoma, we also call it dermoid. This tumor forms from embryonic cells of the ectoderm. That is germ cells, okay? It is the single most common ovarian tumor accounting approximately 27% of ovarian neoplasm. It is composed of serous fluid, fat, bone, hair, nail, sweat gland, sebaceous, etc. Bone, and even the sebaceous gland and the tooth, etc. That means the derivatives from the ectoderms can be found multiple in number in the cystic teratoma, and the sono appearance will appear based on the contained inside the tumor. Understand, if it is a fluid, then it is a mostly fluid enhancement you will see. Fat is a echogenic but not hyper echogenic. Bubbles, multiple fat bubbles you can see inside. The bones, you will see the hyperechoic followed by shadow. Here you will see the line, nail, sweat gland, sebaceous gland. These are medium level echo. And the tooth is a hyperechoic and the posterior shadow. Okay, so that's the way you will get it. Okay. Although rare, dermoids can be found on the spleen, lung and neck. Found on the spleen, lungs and neck. Okay, the sono appearance, that is very important. Well defined complex mass. The fluid and solid components may demonstrate a fluid level. Calcified areas may demonstrate shadow. Cystic areas will demonstrate enhancement. And